What is Roseola? For the last 2 days, your baby has had very high temperatures. You take her to your family doctor, but even he can't seem to figure out what's wrong. As a precaution, he gives you a script for antibiotics, but tells you not to use it unless your baby's condition gets worse, as she may have a viral infection instead. After a few days, your little one doesn't seem to be getting any better, so you decide to fill the script and start her first dose of antibiotics before bed. You wake up in the morning and see your baby smiling and playing happily in her bed, but there's a red rash all over her body. Oh no! Is this a reaction to the antibiotics, or is it something else? Hello, and welcome to MedTouch, the best place to find the right medical information. Roseola infantum, also known as Zika disease, is a very common and highly contagious virus that affects babies and young children, most commonly around the age of 2. The infection is caused by 2 strains of the herpes virus family, which is typically spread through coughing, sneezing, and contact with infected surfaces. If your child has Roseola, they may develop a very high temperature of around 39.4 degrees Celsius or 103 degrees Fahrenheit, which can last 3 to 4 days. Other common symptoms include a loss of appetite, a runny nose, mild diarrhea, and swollen glands around the ears and neck. After a few days of being unwell, your child's temperature may suddenly drop, and at around the same time, a pinkish red rash may appear on their face, neck, and torso. The rash typically appears raised and spotty. The rash itself does not cause any discomfort and will usually subside within 48 hours. Because doctors typically cannot diagnose Roseola until the fever subsides and the rash appears, many parents and some health professionals wrongly assume that the child's rash is caused by an allergic reaction to medication such as antibiotics or paracetamol. It's important to remember this cycle of a high temperature followed by a rash is a normal part of the viral disease course and not due to any medication that the child may be taking. Roseola also is one of the major illnesses in which children can get febrile convulsions with. Febrile convulsions can cause children with predisposed brains to experience a seizure in response to a sudden rapid increase in body temperature. As Roseola causes high temperatures, kids susceptible to this condition may be more likely to experience a seizure. It's important to note that if your child experiences a seizure while having Roseola, it doesn't mean Roseola caused their seizure. It means your child has a lower threshold for having seizures in reaction to high temperatures, which can be caused by an infection or illness that caused their temperature to rise past their threshold. If your child experiences a seizure, or if their symptoms don't seem to be due to a simple runny nose or cold, seek medical advice as soon as possible. There's no specific treatment for Roseola, as the infection is usually mild and self-limiting. Lowering your little one's fever and making sure they stay well hydrated and get plenty of rest is usually all that's required until they are back to their healthy and happy selves, typically within a week. Thank you for watching. Be sure to like this video, subscribe, leave us a comment, and turn on that notification bell so we can stay in touch.